Eczema or atopic dermatitis is a skin condition that makes your skin dry, itchy, red, and sometimes there might be oozing of fluids. It is mostly common in children, but it can occur at any age. Usually atopic dermatitis goes down with age, but few other type of eczemas like exogenous eczemas due to contact with some allergen may happen at any age group. Eczema is a chronic condition and long lasting flare ups may be there. There is a tendency of asthma or hay fever to be associated with it. It is not like that you are treating eczema, that's why you are developing asthma, or you are treating asthma and you are developing eczema. There is no permanent solution or permanent cure. Yet, with atopic dermatitis, there are a lot of preventive measures along with very good medicines that can control your disease or the outbreaks and can give you a proper relief from your skin conditions and itching. Taking some precautions such as avoiding use of harsh chemicals like in soaps or in moisturizers or in your cosmetics. Applying prescribed creams and ointments and even moisturizing your skin properly with a bland emollient can give you relief from atopic dermatitis. The common signs and symptoms of atopic dermatitis are like very dry and itchy skin, red brown patches in the wrists, hands, your palm soles, your face, your elbows and knees. Even it can affect your scalp. There may be a loss of your eyebrows, hairs. Sometimes there may be secondary infection on top of it. So there may be pus or small bumps that can leak fluid. There may be scaling, cracking, even there may be minor bleeding from the scratching. Skin may be swollen, sensitive and red. It mostly affects toddlers or preschool goers before the age of 5, and it could well persist into adolescent and even adulthood. For some persons, eczema is volatile in nature, where it flares up at one time and then again clears up, and that cycle could continue for several years. There are plenty of causes of atopic dermatitis. Essentially, if you have healthy skin, it retains moisture and forms a protective barrier against irritants or allergies or the bacteria. In case of eczema, this protective layer of the skin is compromised due to a genetic variation or due to some other family predisposition. That's why your skin loses the ability to protect itself. Hence, external environmental factors can thus affect your skin, causing flaring up of eczema. In the case of children, food allergies can also play a role in flare up. Certain factors can flare up eczema or your atopic dermatitis, like very dry skin can cause it. So, moisturizing your skin with creams, lotions or ointments in dry seasons like in winter, maybe thrice or 4 times a day, and in other seasons twice a day, can seal the moisture properly and prevent the development of eczema. So, choose a product that is best for you. You can take help from your dermatologist and apply it in plenty to your skin to keep it properly moist. You have to make sure that your skin looks shiny so that it protects your skin in a proper manner. Use a bland emollient, that means without fragrances or color, and like petroleum jelly, coconut oil, light liquid paraffin that has less amount of chemicals that can trigger allergies or reaction. If you have eczema, your skin reacts differently to certain triggers like dusts, sweats, different harsh soaps, pollens, animal danders. If you have pets, you have to be very careful about it. So this can trigger your eczema. So prevent those triggers from getting exposed to your skin. Food allergies are likely to be one of the cause in children, but not in adult. Avoid giving those foods, those may cause reactions like sometimes wheat, soya proteins, eggs, and sometimes milk. Consult your dermatologist or your pediatrician for a proper guideline about your food avoidance or other triggers that can be avoided to prevent recurrence of eczema. As the skin is already dry, you should not dry it more. You should not wash your body like taking shower for a long time or taking shower repeatedly may be harmful for you. So limit your shower time with very gentle cleanser or liquid body wash in a lukewarm water is the best. Avoid using harsh chemicals. Use gentle fragrance free soaps or liquid body washes. Those are very soft in nature and doesn't contain much of chemicals. Before bathing, you can apply a natural oil like coconut oil or olive oil, and after bathing immediately put your skin under moisturizer. Apply the moisturizer within 2 minutes of bathing so that it can go down deep into the skin and retain the moisturizer. Use a soft towel to pat dry your skin and apply the moisturizer as early as possible. Don't rub too much after bathing. As I have already mentioned, your eczema may flare up with different triggers. Sometimes infection also can trigger eczema. So whenever there is increase in sign symptoms, even after using those home remedies or regularly applying moisturizers, you should consult your dermatologist or your doctor. If the skin condition is affecting your sleep or your daily activities, like worsening of your itching, mainly at night time, can lead to loss of sleep, and thus your daily activities may get hampered. So consult a dermatologist immediately. This is a chronic condition, so you have to maintain a regular skincare regime like applying moisturizer, avoiding those triggers that I have already mentioned. But still there is a possibility of getting the recurrence or the flare-ups. So when there is flare-up, just consult a dermatologist, don't panic, and remember to follow his or her advice at the earliest. In case your natural remedies and preventive measures is not helping, it is much better to take a professional help so that he can give you some systemic medications or oral medications or injections to prevent your itching or swollen red skin, along with topical creams or ointments that can help you to get better.
To book an appointment with a cosmetologist or a dermatologist in your area, please visit www.skinandhairacademy.in.